If you're pregnant and you are going for your next antenatal appointment soon, please do not leave until you've asked these questions. I'm a registered midwife, and I see a lot of women coming for their antenatal appointments. They nod along and they eventually leave without understanding what was said about their baby or their body. All right, so the very first question that you need to ask as a preggy is my baby growing well as expected for this stage? That is in relation to your gestational age. Is your baby growing well? So I need you to not just assume that everything is going fine because no one flagged it. Just ask directly, just so you are sure. All right, the second question that you need to ask is, what are my blood results showing, or what are they saying? You need to know what your iron level is saying, your blood group, your infection screening. You have a right to understand every single one of this result. Okay. All right, so another question that you need to ask is, what should fetal movement feel like for me at this stage of my pregnancy? All right, so you need to know what fetal kicks that you should be expecting depending on the stage of pregnancy that you are currently in. All right. Another question that you need to ask is, what are my birth options depending on given your history or your circumstances? So you need to know what your options are for where and how you're going to be birthing your baby, whether it's a hospital or a midwife-led unit or a consultant-led unit or even a home birth. You need to consider having this conversation, right? You need to discuss around this point. You also need to know if there is anything specific to your pregnancy or your history or anything at all that you need to do differently for that particular pregnancy. Remember that every pregnancy is different and you should make your care reflect yours. Another question that you need to ask is, what happens if I pass my due date? So the idea is to make plans before you get there, right? Another thing you need to ask is, when should I take my maternity leave? What are my work restrictions? Who do I contact in odd hours? So all of these are questions that you need to ask during your antenatal appointment, all right, so that you are clear about everything that concerns your pregnancy journey. I would love for you to take your antenatal appointments or your visits as an opportunity to understand your pregnancy, your baby's well-being, and how to recognize problems early. Yes, I understand that we do not pray for problems to surface, but having an idea or knowing what to look out for will actually help you throughout your pregnancy journey. Remember that informed women ask better questions, and better questions leads to better outcomes. So I'll need you to share this information or this piece with any preggy that you know. All right, so do well to save this video, screenshot the questions and every other questions that has been a thing of worry to you, and take them with you during your next antenatal appointment, because you deserve answers and not just assumptions. I'm still your favorite nurse and midwife, Nurse Chi, and I'm here to give you evidence-based pregnancy tips and women-related content. All right, so do have a blessed day. Bye.